It is really wonderful to come to this very beautiful city of Thessaloniki to give this lecture. My name is Solomon Tesfaye. I am a consultant physician and professor of diabetic medicine at Sheffield Teaching Hospitals based in Sheffield, UK. My presentation today is going to be on the pathogenesis of diabetic neuropathy and the management of diabetic neuropathy. In the UK now, as in the rest of the world, the prevalence of diabetes is increasing by epidemic proportions. If you go to Africa, it's going to increase by almost 200% in the next 25 years. So society has an incredible challenge to fight these rising tide of diabetes and diabetic complications. And one of the major complications of diabetes is neuropathy or nerve damage of diabetes, which renders the feet and legs numb and prone to injury, and this inadvertent injury can result in amputations. In the UK, amputations are increasing year on year, whereas retinopathy or problems with vision is going down because of annual screening, digital camera screening. So in Sheffield, we're now looking at combined screening for all patients with diabetes. So all patients with diabetes would come once a year, and they would have their eyes photographed, the retina photographed, shoes and socks taken off, and we use point-of-care devices that measure nerve conduction in the feet within 3 minutes. We also use questionnaires to see if they have painful neuropathy, also take blood tests for renal screening. So this combined screening only takes half an hour. It's like an MOT for a car. If you want to look after a car, you have to screen it every year. You don't take the clutch to a particular garage and the brakes to a different garage. Everything is screened one day in a year, and this is perfect. Patients love it, and it saves a lot of money. So this will be the first point I want to make in the lecture: combined screening for all diabetic people. The second point I'm going to raise is diabetic neuropathy has been considered a problem of peripheral nerves, but in the UK, in my unit, we have major discoveries that in fact the neuropathic process not only involves the feet and legs, but also it involves the whole of the central nervous system. The brain is involved in diabetic neuropathy. And painful neuropathy, which we used to think is the damage in the peripheral nerves, we now can see in the brain using advanced magnetic resonance imaging. And this, we hope, is going to lead in the future to new treatments for the management of neuropathic pain, and that will be the second message of my presentation. Thank you very much indeed for your very kind attention.